we'll kind of catch up with things like introductions on the way through. But thank you all for coming. This is a huge difference in the turnout I had last year, where I think filled the first 2 rows. So it's always good to have an audience. So thank you for coming. This is the title, which we're going to deal with. I want to make the point right at the beginning that whatever we do in commissioning, it's all about outcomes. It's all about the quality of care, patient satisfaction, lowering the cost. I'm going to talk almost exclusively about the business aspects of commissioning this morning, but what I would stress, and I will remind myself and remind you from time to time, this is all about outcomes. And of course, the system's under incredible pressure. This particular graph on the side here doesn't even show the most recent years of the constriction of spending, and also doesn't get anywhere near the ring fencing of the NHS and the issues surrounding that at the moment. For example, is the money going to be protected in the future? So we have a huge and complex agenda facing us, and probably a lot less money to do with, so effective commissioning becomes more important. This is, I think, an interesting slide I came across from a report which was published a couple of weeks ago. And the thing which most troubles CCGs, and their ability, of course, to work and deliver their promise, is the money. And 80% of CCGs were at least moderately concerned about their financial position going forward, which places a huge premium on getting commissioning right. So we'll start from this thesis, that only effective commissioning can save the NHS. And I'm grateful to some of the colleagues I've worked with for this particular view of the commissioning cycle, which I've used now for a number of years. What I want to, I think, express through this is the sheer complexity of commissioning. That commissioning probably covers at least 50 discrete, important areas of activity, and a commissioning support unit will have to make a decision about which of these it wants to provide services for and in which it wants to specialise. As industrialisation goes, this is about as complex as any industry is. I've been in financial services. If you take aerospace, I don't think it probably even comes as close as the complexity of commissioning healthcare. And we all have to become proficient in each of these skills to ensure that commissioning works effectively. And this, of course, is the variation risk as well. 211 CCGs, 18 CSUs, just 50 commissioning components, and there are probably 300 basic skills which a CCG has to deliver. So are there going to be 10,000 ways in which we actually construct a solution for these items on the commissioning cycle? And of course, many mature industries don't have this problem because they've worked their way through it and they've found the best way of delivering what they deliver. So I think we need a robust commissioning support industry to get help across the commissioning cycle, find ways of actually helping 211 disparate organisations, and I'm acutely conscious of how different CCGs are. Big ones, small ones, rural ones, metropolitan ones, affluent ones, deprived ones. And this is part of the challenge. And what we've got to do, of course, we've got to do this pretty quickly. So where do we go to learn? Well, I think that, and I'm going to come back to this in a moment, that we learned an awful lot during the period of world-class commissioning. And it would be a shame, really, for us that legacy to be dissipated. So I think there's ways in which we can revisit that. There is a huge number of extraordinary commissioning initiatives across the NHS. And it wouldn't it be good if we could just find the one or two here and there and try to work whether in fact they are going to be the fundamental ways in which we can move forward as the core way of doing a particular proposition. And across the world, of course, a lot of other people have become much more expert at commissioning because of the way in which their health systems have been designed. The purchaser-provider split, particularly in the US, means that what you will see, of course, is a much more vibrant and active commissioning part of the balance equation than you see, for example, here. And I can't stress the fact that we've got to do this quickly. The money is running out, and unless we actually get engaged as fast as we possibly can. And this is where, of course, we're looking for CSUs to help the CCGs move onto a higher trajectory. But even that kind of incremental, iterative way of actually approaching the issue, I don't think is necessarily going to be particularly successful, because somehow we've got to make it go exponential. And there are lots of skills which we need to bring to commissioning, which again have been invented in other places, which we really need to adopt very fast to get us there. Because if we don't, we have to confront this, where the provider side of healthcare is actually moving exponentially already, and has been for some time. And this is classically illustrated here by the way in which the Human Genome Project is being developed. It is now, the pace of it is outpacing Moore's law. The cost of DNA analysis has come down to $1,000. The machines that do it are $150,000. So the impact of where we're headed, and of course we're getting just the same in biomedicine, pharmacology, surgery, and appliance. So commissioning somehow, if it's going to manage the supply side growth, it's got to go exponential itself. There are ways in which we can do this. The last session, and I know many of you were here, we talked about the importance of knowledge and data. The NHS is awash with extraordinary data. As a healthcare system, we have the best data sets in the world. But somehow, so far, we haven't, from a commissioning perspective, made the best use of them. And what we've got to do is join this big data movement and find ways in which we can really start to understand, for the patient's benefit, what's in the data sets. We want great outcomes. We want great outcomes. A few introductions. Who am I and who is Healthcare Commissioning Services? We were founded 3 years ago because we saw that there would be a need for commissioners to work more effectively, and as the commissioning process would change following the white paper, what should be done to actually effect the start of a new industry. What you see outside here in the Innovation Pavilion we built with the help of 18 CSUs who came together the first time to create some sense that we are now embarked in an industry. And yesterday, if you want, this outside was the trade show for Britain's biggest new industry, a £1 billion industry, which is commissioning support. So what we've been trying to do is create some impetus, some direction to the way in which commissioning should start to form itself as an industry. There's two of us really head up Healthcare Commissioning Services. I essentially have either worked for or been a manager on the left-hand side, and my colleague David Collingbourne is on the right. So these are not clients. This is our experience of where we've been. So we've had a 20-year view of commissioning across the world. I've worked in the NHS as Director of Commissioning in Hampshire, and I've also been Managing Director of Bupa. So for 20 years, on both sides of the Atlantic, I've had a good view of what this commissioning enterprise should be. And what we want to do with the agenda today is really look at the business opportunity for CSUs, some of the examples from around the world of best practice, how CSUs might start to target particular product areas, and how they might collaborate amongst themselves, and how they might get ready to have a more assertive and aggressive view of the market to actually meet that exponential need. So as I've said, a £1 billion industry, it will grow, and somehow as well, if you're from a CCG, you've got to work your way through this marketplace and determine what's best for you. And I suspect that effective quality commissioning services will be in short supply, because that is the nature of the marketplace. So if you're a CCG, you might be in a sort of land grab environment at the moment, and I commend you to walk around the show and ask the most serious questions about your particular needs and try to work out who in the future is going to be the best customer for you. How big could it be? We reckon it's probably worth about 400 million, and that's taking 8 of the £25 and multiplying it by 52. The HSJ says it's 650. In other healthcare environments, commissioning will be spent continuously so long as it produces a return on investment, i.e. if care costs are taken out, commissioners will continue to spend. There's no arbitrary limit of £25. If you can take out £5 billion of expense by spending £3 billion, do it. This is what every industry, and somehow we're hung up on the bureaucracy, it's £25. Because that may well be a politically expedient number, but we have got to spend whatever it takes to make commissioning effective, to deal with some of the financial challenges I've spoken about. And at externalisation in 2016, this does mean that right at the top of the Sunday Times fast track will be the surviving CSUs. And if they don't get there, again we could be in trouble. So this is where we do need now CSU 2.0. And there are other business models to choose from. I've worked extensively in the US over the last 20 years. What I've seen is the growth of commissioning support there. It's called third-party administration because essentially it's an adjunct to the insurance industry. So what you see are a number of players. Google TPA, or third-party administrator, and you will come across these. Even organizations like the Cleveland Clinic are saying, we now need to be in a position to ensure that we understand how the money is being spent on patients, what the outcome quality looks like. We want to be in it. What you're seeing is as well is a lot of others are adopting big data platforms and approaches to the way in which they go about commissioning. This is very much an industry which is looking at its metrics and looking at claims validation, risk management, business decision analytics, and case management support. And it's fragmenting. What you're starting to see is highly specialist organizations doing one simple thing, and as a consequence of which, joining with others to make a much bigger whole and supply into all of that. I was involved setting up the Bupa TPA commissioning support in 1994. The whole of the UK health insurance sector providers and commissioners, the insurance companies, have actually had one data utility since 1994. It cleanses, validates all of the data and passes it to the insurance company in a consistent way, enabling the insurance companies to draw conclusions about the data. So we're almost 20 years into that in the private sector in this country. So, CSU, if I'm a CSU, what particular strategy am I going to adopt? If I would have been Steve Jobs, what I would have done, I think probably what I suspect I would want to have done is specialise, differentiate myself, and be famous for something. And that, I suspect, is probably not necessarily the winning strategy, but the surviving strategy, that you actually find a way in which you can excel in a particular business area. Clues how you might do this. This is some work which I did with a number of PCTs towards the end of world-class commissioning. This shows the distance they had to travel to meet a particular commissioning need. You can have all of these slides. You'll find the address at the end, and we'll give them to you if you want to see the detail. Another way of I did some work just before Commissioning Support London went into its demise, and I worked with them to try and find out if there was a rescue available to them. It very much came down to the people. The management and the quality of the people were the issue there, and that they weren't maintaining the patronage and support of their customers actually created their demise. The other way to do it, of course, is just to go and look at the CCG's report on how it's done in its authorization process and look for the gaps and see whether in fact you can start to fill some of those gaps by looking at either a local or a regional or a national need. And finally, of course, we're now starting to see market research, and what they have started to reveal is data, knowledge, and human resources are what CCGs are saying is their biggest need. And when they are actually asked about the supply side of it, well, a lot of them are still very concerned about the quality of the support which is evolving to help them with this particular need. just to go back onto product selection now, what you see here is the FESC proposition, which I was involved in back in 2007. This essentially said, well, you can, if you're a PCT, you can do all of this, or you can do some of it. And what we saw was, of course, some PCTs focusing on particular aspects and others focusing on a whole vertical area. And the choice, of course, for CSUs now is, should they go horizontal and be end-to-end, or should they go vertical and be a specialty store? We cannot tolerate 211 individually crafted commissioning cycles. Somehow we've got to find the one best way of actually having that. I got a grant from the Technology Strategy Board a couple of years ago with some friends, and we then decided what we'd have a look at is how we could actually turn this into a value chain, into a supply chain. So we took the NHS London commissioning toolkit, which is this particular diagram, and what we then said, well, we'll cut it in a particular and lay it out as a cycle, as a supply chain, and this is the category. If you look at those colours above and around the circle, these are the same ones. We then decided to flip them and turn them into verticals, into product specialisms. Had a go at putting a per patient value on them, and then trying to work out what was the size of the market of each of those individual sectors to add up a total market value of 400 million. And again, if you're a CSU, I guess what you're going to do is to work out exactly where you're going to specialise and exactly how you're going to make your money. What we're interested in seeing now, of course, is that there are 18 CSUs out there. Is anything like this starting to emerge? Are any of them starting to specialise in a particular way? And what's going to be the quality of them? I just took the 9 product competencies and ran 18 across and just tried to guess what the mosaic looked like. Nobody knows, because we're in a state of market formation where nobody should know. But what if they all started to think about, shouldn't we do a couple of these and really sort of dive deep into creating a capability of actually specialising, leaving the rest to others, and maybe then we might end up with a position where the whole market gets to go green. So, CSU's outstanding product offers, the CCGs, I believe, will be the winners. A focus on a few core competencies is likely to be the least risky strategy. I didn't say a winning strategy, I just said the least risky strategy. And that's what most enterprises do. But which of them will CSUs choose? And will they have the courage to choose? Or will they want to be all things to all people? There is, of course, an opportunity as well of actually working between the two and joining up bits of the supply chain to create more coherence. So we believe there is a role for CSUs in actually working their way, joining up the supply chain and making sure that's delivered into their CCG customers. I'll come on in a minute to talk a bit about this right-hand side, but this is our view of what comms and engagement would be. If you go back to the very first couple of slides and look at all those competencies and how you actually had to put the various elements together to create a coherent comms and engagement strategy. So here is, in my idealized world, CSUs starting to pick off a couple of things each. They could be any combination. And they may not be these ones even at all. They may choose to do something completely different. But what I would advocate, of course, is they do start to choose. There's an urgent need to find the one best way. Most industries, as a consequence of Frederick W. Taylor, the man who actually invented scientific management, which created the industrialization of the world, starting in America in the late 19th century. Every business I've worked in, eventually we all share essentially the same back office tools. What we need to do that, and of course, somebody like Steve Jobs was the expert product refiner. He knew how to source the best solutions for his products all over the world and carry on designing and refining them. 20 years ago, when I was working in New York, we actually developed this way of actually developing a product. Again, you'll be able to see it when you get the slides, but This is the way in which you grow a product from a simple generic proposition outwards and outwards and outwards. It's familiar with everything we consume or use, but I've tried to adapt this for commissioning, and you'll see that on the right-hand side, and you're very welcome to it. So, beyond all of that, of course, is that you start with the commissioning cycle, you choose your competencies, but you've still got to install them. And we reckon as well that there could well be room for a CSU which just focuses on bringing all these components together and doing the installation. So back office services are a critical need, and what we of course need to do is to find ways in which these products can be assembled to create the most coherent and winning solution. So, if you're a CCG right now, are we sourcing the right products and services for our locality? Is the allocated CSU the strongest business partner across all the competencies? 211 divided by 18 times 50 is the number on which to focus. If you don't grab the best, you may be left behind. So it may well be that this is something where you won't have the time to be too fussy about your selection process. And judgment and hunch and entrepreneurial spirit might push through. But also, most importantly, how do we actually blend both the CSU and the CCG goals together to achieve what we want to achieve? So, summary, huge challenges facing the NHS. Effective commissioning is critical to its future. An immediate need for CCGs to engage fully with this agenda. Rapid business formation is an imperative for CSUs, who must determine what's the most appropriate business model and priorities for them, and selecting the best product lineup is key, but I reckon specialisation is paramount. And then we might get towards CSU 2.0 with the hope and prospect that we get great outcomes. Now, it's 11:30, or it's actually 11:28 according to my clock. I'm going into a commercial now, if I haven't been giving one already, and I'm going to make some suggestions about how we might work our way through this. You can leave any time you want, but I'm going to crack on. What are the 10 most important deliverables CSUs might offer? Here are my own suggestions. We need a common theme for commissioning, and I'm suggesting that we might actually go back to world-class commissioning as the way in which we can actually do that. Let me go. I've worked with 35 PCTs doing world-class commissioning. This is some of the work. Our extended range of colleagues, when I worked with Humana doing this, we probably worked with 55 PCTs, so I think we understood some of the issues. We found that world-class commissioning created some coherence, a sense of identity in the mission, and there isn't one at the moment, I don't think. So if we can find some theme, and it doesn't have to be exactly where we came from, but something like that, it might help. And certainly if we can start to triangulate the sort of work which NHS London did with world-class commissioning and the competences which you see as part of the authorisation process at the moment. In all of that, if you actually delivered that, it's a very high quality commissioning product. And you know, there is really genuine good work, excellent work in this, and we shouldn't lose it. I know that, for example, there's work which was done by the Commissioning Institute. I was working with something called the Commissioning Community. There's a whole university course on commissioning, and we have access to that IP. And if, for example, you're a CSU, wouldn't you want to train people in your product in an academic environment? You know, and what I'd like to stress is that competencies are products and products are competencies. So this may well even be an opportunity for a CSU who actually wants to go into the training business and work actually to ensure that the most effective solutions are developed and delivered. What you see here are 3 events which commissioning support units will be at, but isn't there room for something to happen in between. We can't stagger from big national event to the next national event. What we need is some organisation to create some glue in terms of the way in which they can actually get a focus on a particular competence, on a particular product, on a particular service, where they can bring their solutions to that and engage with the CCGs in improving the proposition. And as I'm a part of all of this particular show, we're certainly looking for CSU partners to take that forward. I believe there's an opportunity to wiki commissioning, to actually turn it into sort of a participative exercise, and always deal with it as a part work. We have publishing partners who are ready to work on this, and again, we'd be happy to give airtime to commissioners. What's, of course, is starting to happen in universities, colleges, particularly in America, is that most of the learning now is going online. You can sign up now, any of us can sign up to a college course and get access to the lectures and the case notes, and if we pay for it, we can even have our work marked by the same colleges. So is there a way in which we can actually create a MOOC for commissioning? 5, almost at the end. We're going to need completely different skills to actually work their way through all of this data and all of this knowledge. I worked last year trying to help people who are being made redundant from their PCTs find new futures. And my advice to a lot of them was really, if you've got quantitative skills, go out and get them polished. If you've got a mathematical or a scientific mindset, really work hard to improve your maths and stats capabilities, because that is the coming future of commissioning. So anything you can do to recruit or improve the quality of your talent in the STEM skills will be, I think, enormously important to you. We've got to share what we have. We've got to share the best of what we have. There's some outstanding solutions out there. There's lots out there in that hall. There are many more from organisations, I wouldn't call them, from people I know who can't afford to be in this hall as exhibitors. But I know from my time in PCTs, have extraordinarily solutions, particularly in the quantitative area, which they can bring. And what I'm looking for are CSU business partners to actually go into business and collaborate with some of these people to get the best possible intellectual property into the hands of commissioners. This is some of the work, again, just based on the chart I showed you earlier, what we've been doing. It's not exhaustive. We could probably fill up the slide. And here is more practically some of the work being done by some of those developers to enable them to put them in a position where they could help CCGs to deliver a much better local service. We, Healthcare Commissioning Services, we reckoned, because of our experience, that because there was a gap in comms and engagement, that we'd actually create our own advertising agency, our own communications agency to actually fill this gap. It's established in southwest London. Again, we're looking for a CSU partner to actually help us specialise in that. And this is what we encourage, I think, all of you who work in CSUs to do. Go out and find people who've got something genuinely different and differentiated to offer to ensure that your CCGs get the best solutions. I spoke about joining up the verticals. There is a manufacturing need out there in commissioning to actually put the supply chain together, and what I'm suggesting is that some CSUs might want to specialise in that. The business process engineering skills are something which will be at a premium. We definitely need commissioning architects, and we also need commissioning manufacturers if we're going to make progress. Last one. We want great outcomes, but we need, number 3, to find the one best way. What I've tried to emphasize during this presentation is that all the time we're looking to try and find the best way, because we need to get up that exponential curve as fast as possible if we're going to deliver effective commissioning, and I think, as well as I said before, even save the NHS. So, if you're a CSU, just to summarise, how will you specialise? What will be your product and service selection? Will you be CCG driven, market driven, or survival driven? Where does your risk analysis take you? Where are you going to be in 2016? Exit, externalisation, if you are there even. What will the shape of your business look like, and how will it evolve between now and then? So therefore, what will be your intermediate product strategy, and what's going to be your focus? This is the final commercial, but certainly if we are available to help CSUs, the bold line there, even get their products and services amongst other CSUs and into CCGs, because again, we think it's critical for as many of the winning products to be out there as fast as possible. Probably the best way, if you want this presentation, just mail me at my domestic address, all right, Roger Hymas at btinternet.com, and I will turn it round sometime over the next couple of days. You're very welcome to it. Thank you very much for coming along. I've appreciated your attention, and that nearly all of you have stayed. And don't forget, we want great outcomes, most importantly. Thank you very much. Got time for some questions if you want to stay, because this room is available for a little longer, but it's your call. Keith, can I ask you to be a chairman? Can you, because I can have a drink then. If anyone wants to put a hand up.
Any questions of Sir Roger Hyman? Lady in black.
Hello, I'm from Macmillan Cancer Support, and you talked obviously about CSUs, and I just wanted to ask you what you see the role of the voluntary sector being in commissioning support services, and if you can give examples of your experience in the States elsewhere of that.
Yeah, I was having a long conversation out there with the Care UK lady yesterday, and she was talking to me about an extraordinary piece of work they're doing in Cornwall to try and integrate aspects of care, and how they're working very fundamentally in a GP practice or a few GP practices, gathering the data, identifying the people most at need and most at risk, and trying to create almost a hand-built solution for these people in relation to their needs. I think voluntary organisation should not only be effective care providers, but also bring their skills in commissioning to help commissioners work more effectively. And just that 5 minutes with the Care UK stand yesterday sort of certainly filled my soul with some joy and some confidence that here were some very practical ways in which you could improve. And it didn't need all this stuff. It just needed a very practical, down-to-earth bunch of people working to an agenda which they identified.
Further questions?
Well, here we go.
Sir, there's a mic heading your way.
My name is Joran Mendel. I work for PricewaterhouseCoopers. We've worked with NHS England around the new kind of commissioning support for the framework. So you're clearly advocating for CSUs to specialize in certain areas. Clearly, Bob Ricketts yesterday in his presentation of the new framework is proposing a framework that is actually focusing on end-to-end suppliers. Clearly that's up for consultation, but I was interested in your views on whether you see that those two things can be married together.
Pricewaterhouse, do you know PricewaterhouseCoopers?
I know them reasonably well.
I used to work there. Actually, I sat through that presentation as well. And also I'm delighted that PricewaterhouseCoopers comes to our presentation, so thank you very much. My take of it was that you should certainly start with the smorgasbord of end-to-end, but that it would be for people to decide whether they wanted to do the whole smorgasbord. I did have a conversation with him 2 or 3 weeks ago, and I said to him, Bob, you're not bringing back FESC, are you? And he said, no. So what I'm hoping is that whilst the end-to-end proposition does exist because they are all the commissioning elements, that probably nobody wants to take it on. Yeah. I'd be grateful to know, for example, if you would want to take it on. And because you have more skills in your organisation to actually deliver something like this, and whether it's even within the scope of a CSU to absorb what, in the case of FESC, was 144 separate, discrete competencies which made up commissioning. I thought Bob was more ambivalent than that. Any more? Okay. Thank you very much for coming and for staying, and enjoy the conference. Thank you.
A vote of thanks for the...